So how about your comments?
Yeah, I have a question.
Yeah,
Thank you
yeah,
for
of
your
course.
good video. And do you perform the retroperitoneal lymph node dissection only with robotic system now, or do you have any indication to choose open surgery between the open surgery and robotic surgery?
Thank you for the question. So we have a very strict selection criteria for robotic surgery, and usually lymph node sizes of above 8 to 10 centimeters we do open, and we see according to the CT scan if the great vessel involvement is more than 270 degrees, we usually prefer open techniques. Otherwise, we prefer the robotic technique primarily because we've had a very good exposure and experience of robotic surgeries in our unit. We've got a adequate exposure of experience of robotic prostates and cystectomies as well. So we are quite confident about RPLNDs robotically. But otherwise, tumor sizes of over 10 centimeters, we prefer open. And those which are involving the vessels by more than 270 degrees, we prefer open again in them.
Because some of
Yes,
my
may I,
colleagues just think the previous surgery history can be another
Exactly,
important
yeah.
factor.
Previous surgery again. But again, sir, in those cases, we usually prefer to start robotically because there have been cases where even in past scarred abdomens also we have performed RPLND successfully. So we prefer to start robotically, but if we feel that there is an issue, we don't hesitate in converting to open at any time.
Thank
Thank you.
Professor,
Yes,
go ahead, please.
yeah, thank you very much, Dr. Agrawal. This is very challenging procedure.
Thank
So,
you.
do you think, do you need to identify the like a sympathetic change or of the surgery, and also do you need to put the clips for the lymphatic channels
Absolutely.
because you did not show any video? Yeah.
So we use metallic clips usually for lymphatics. Uh, Whenever we find them, we usually clip them with lymphatics. It's said that it helps in reducing post-operative lymphoria. And regarding your first question about the nerve sparing part, so if we are
Yes.
doing a primary RPLND, which is a pre-chemo case, we definitely do a nerve sparing technique in them. Usually the nerves arise in sorry yeah, so the nerves usually arise in the retrocable region and they go towards the aorta and below the IMA, that is into the into the hypogastric plexus. So we preserve the nerves usually in pre-chemo cases, but in post-chemo cases we are quite aggressive in our approach because and we do not try to preserve the nerves in those cases.
Okay, thanks. So we have a lot of questions, but no time. So
Uh,
let's move on the